Dr. Ellison, can someone like stop having cancer? Like, because we cut them off of health insurance?
No.
Yeah, can they all of a sudden be healthy? Everything's great. You don't need insulin. You don't need. My husband and I both work for ministries and nonprofits. We spend our time seeking to serve other people and are grateful to have the lifestyle despite the financial challenges. But we have known seasons in the past when high cost of healthcare meant that we were forced to defer treatment.
Congresswoman Rashida Tlaib delivered an emotional statement during a healthcare hearing condemning cuts to Medicaid and the Affordable Care Act. She began by asking whether people can stop having cancer just because they lose health insurance, highlighting how illness doesn't disappear when coverage does. Tlaib read heartbreaking letters from her constituents, families battling cancer, seniors losing coverage, and even an 18-year-old struggling to help her disabled father afford care.
Next up for a question is Congresswoman Rashida Tlaib.
Dr. Ellison, can someone like stop having cancer? Like, because we cut them off of health insurance?
No.
Yeah, can they all of a sudden be healthy? Everything's great. You don't need insulin. You don't need all the, I'm being serious. I think
Right.
my colleagues are acting like that somehow our residents can stop being sick, can stop needing, or they don't have any special needs or disabilities all of a sudden. They're cured. No one plans to get sick, right, Jonah? I mean, nobody plans to get sick. No one.
No.
Do you plan your child to get sick? Do you plan on like getting cancer? I want to read to you guys. It's really devastating that I feel like my residents, it makes me actually want to cry, that they're begging me. The fact that they're begging their own government to care about them as if it's their fault to get sick. This one wants me to know that her and her husband have health issues not related to lifestyle. Why? Because I have colleagues that actually try to blame them for getting sick. She said, my husband is a non-drinker. I drink rare occasion. We both have never been smokers, but we both have cancer. And she goes on to say, my husband's a retired public school administrator. Yeah, we can't do it. She said all the new plans increase cost of copay, medication, co-insurance. She goes on and on. Another one is as a husband, and this is a quote from them, because I like to bring the district here, because there's such a disconnect here of really the pain at home. My husband and I both work for ministries and nonprofits. We spend our time seeking to serve other people and are grateful to have the lifestyle despite the financial challenges. But we have known seasons in the past when high cost of healthcare meant that we were forced to defer treatment for digestive problems, for new glasses, right, Doc? I mean, people get carpal tunnel. They just don't come in because they can't afford it. The plan we have, they said, through the healthcare marketplace, as it stands today, has helped us attend to our medical needs so we can go on serving other people. If the healthcare costs go up, we'll be right back in the zone of being unable to get the care we need, making it harder for us to serve community. And if I may, this is really just heartbreaking. This person said, this year my employer eliminated my position. I had amazing health care. I now rely on a plan at the Affordable Care Act marketplace, which doesn't cover much, but I have something. I'm a senior citizen and going without health care is not something I want to do, but without the subsidy, I have no choice. Mike Johnson needs to get a grim reality check, as it is him and the Republicans that are causing the shutdown. We can't rely on them to deal with it later. Remember that. Again, it's not like somebody can get it, stop being sick. He said we can't rely on them to deal with it later because it would be nice to know how much our health care is going to be. Maybe he should go to his district and listen to his constituents. I'm sure they're not happy with him either. And I read after the other. But the one that kind of really breaks my heart is, I rarely get really young people to email me or, I get the direct messages, sometimes. But this one was heartbreaking. She said, my father is on a fixed income and has been permanently disabled his whole life. She said, these funding cuts have put him and our family at risk of losing health care coverage. On top of that, she said, our living expenses have skyrocketed to the point where we have to pick and choose which bills to pay each month. We're always uncertain of whether what we will get will be enough to pay for our food for the next month as well. She says, I'm 18 years old. I'm already working too, but it's not enough to support my family, myself, an 18-year-old having to worry about this. I mean, I don't have much to say, but I wanted to get this on the record We're having this hearing because they're not creating spaces for us to hear from families in our district. And, Doc, I started with that because I feel like there is this almost blame or acting like somehow our neighbors that get sick are disposable.
Right.
Let them die. Let them get sick. Who cares? Let their quality of life decay. And I'll tell you over and over again, even where we know some of the cuts to, Medicaid will not happen until the next year. We know people are making those decisions now, though, of how to address them. But we had people call my office, sick, crying because they canceled their appointment, thinking it's already in effect. Cancel their appointment. This is going to be devastating because people are going to be like, I can't afford it. And they're going to stay home. And they're rather just going to get sicker and they're not going to be able to take care of themselves. This is incredibly, again, shameful for many of my colleagues who, on the other side, many of them have access to health care right now, but majority of their families at home, many of them, again, I have about 38% Medicaid recipients. Some of my colleagues on the other side, over 60%. I can't even imagine how their residents must feel. Doc, I know for me, Medicaid, I think of Black maternal health crisis. I think of infant mortality in my community. And when I look at over 40% of births are covered from Medicaid in my state, that's postpartum, that's prenatal. You know this. I just don't think my colleagues get it. It's not like they can stop being pregnant. No, really, at the moment, if they're having birth, it's not like, okay, well, I'm not going to, it doesn't make any sense to me that, again, we're creating an environment. I know, I'm so sorry. It's just really sad that we continue to have this. And I'm really pleased. And so thank you to my colleagues for allowing this space for me to bring the stories of my constituents here.